All right, let's quickly learn how to read a ventilator display screen. First, we have assist control, which is the mode of ventilation. It's set to volume control currently. This can be set to pressure control or volume control. In this case, it's volume control. Next, we have respiratory rate, or F for frequency. This is set to 18 breaths per minute, and we can see the actual respiratory rate of the patient is also 18. Patients on assist control are allowed to breathe over the ventilator if they're agitated, if they're febrile, if they're in pain. Sometimes the respiratory rate will be higher than the set rate. Next, we have tidal volume. We can see the tidal volume is set to 420 cc's, and then at the top we can also see that the actual volume of the patient is 430. There's a slight variance between these two numbers, no big deal. Next, we can see the minute ventilation of the patient, which is 7.6 liters per minute. Minute ventilation is the respiratory rate times the tidal volume. Moving on, we can see the oxygen setting for the patient has an FiO2 of 35%. We can see that the positive end expiratory pressure, or PEEP, is 8.0, and then we can see the actual PEEP of the patient is 8.1. Next, we have the inspiratory to expiratory ratio. Normal for a patient on a ventilator is 1.2 to 1.3. We can see the peak pressure of the patient is 31. Normal inspiratory peak is less than 40 centimeters of H2O. And a plateau pressure, which we would need to view by doing an inspiratory hold on the ventilator, is normally less than 30. Next, we can see our circuits, our graphic representation of pressure for each breath. And then below that, we can see the graphic representation for volume. This is the flow in inspiration and expiration and how the airflow is delivered. All the way at the bottom, you can see the ramp setting, which is in a descending line.